Hey, this is Natalie, and I am going to talk about um, omega-3 fatty acids and what the benefits are in relation to diabetes, heart disease, and overall health in general. Um, omega-3 fatty acids, they are often found in plant sources like nuts and seeds like flaxseed. They're also in fish such as salmon and tuna. Um, Omega-3s are important for development and building cell membranes. Have been proven to lower triglyceride levels, which lowers the risk of heart disease. It helps with joint stiffness related to arthritis and joint pain. They lower the rate of depression even in people who are bipolar, and they help in baby development in the womb. Um, and it's actually omega-3s are really crucial for vision and neurological development in a baby. Omega-3s lower the inflammation rate um, in relation to asthma and your bronchial tubes, and can reduce symptoms of ADHD and even of dementia. Specifically in diabetes, Carrie Ann did a great job of explaining how exactly this worked in patients with diabetes. But because patients that have diabetes often have a lower HDL level, omega-3 fatty acids can lower the triglycerides, which will then raise up their HDL level. In heart disease, it's important to eat a diet that's low in saturated fat and eat foods that are rich in monosaturated and polysaturated fat. Omega-3s will actually lower the fat in the blood and therefore lower the risk of buildup in the arteries, which buildup in the arteries obviously can lead to high blood pressure, stroke, abnormal heart rhythms, and just hardening of those arteries that will can cause clots. So omega-3s can slow the risk of clot buildup. It's important to eat at least 2 servings per week or take omega-3 fatty acids, which helps to reduce the risk of stroke, and that's proven by 50%, which is huge. So that is a really big reason why omega-3s are important. Buffy had stated that fish oil may possibly reduce the risk of plaque buildup in the arteries, and she made the analogy of like possibly your car will start when you wake up in the morning, but I actually found several studies that have proven that it reduces that risk. Um, so I'm going to just name a few of those. There was a randomized study with 563 men that had hyperlipidemia, which is like excess lipids in the bloodstream, and high cholesterol. And out of the 563, they did a study over 3 years of having them take omega-3. And with the study, the results showed like almost all of them, the elasticity of the patients in their arteries improved and the plaque buildup decreased. And that's just a huge number, 563 taking these over 3 years. And these men were older men who had never taken them before and had always had plaque buildup. There were a couple other studies I found. There was a study done in Japan. Hold on, let me find it for you. Okay, and they had they used a placebo actually. They had and they used Americans. They had 306 white Americans, 281 Japanese, and then they kind of split like between the two of them. Some placebo drugs and some had taken omega-3 fatty acids, and they didn't tell the patients who was taking what. And it proved that both for the Japanese and the Americans, those who were taking the true omega-3s lowered their triglycerides by a huge amount by taking just fish oil, and they hadn't changed anything else in their diet or exercise in this study. Sweden also did a similar study. They used less patients. They have a placebo-controlled study of 35 obese adolescents in Sweden, and they put them on omega-3 fatty acids, and their triglycerides lowered as well as their arterial stiffness, which they tested beforehand. So there are studies that prove that it actually works on a more personal level. My mom actually has high cholesterol that's genetic. She is an instructor at the YMCA and has been for 20 plus years. She's in great shape. She always has been. She eats an extremely well-balanced diet, and her cholesterol is high. And it's genetic. It's on her side of the family. My mom has taken Lipitor and several other cholesterol-lowering drugs that she's had terrible side effects to. Um, and the Lipitor actually almost killed her at one point. So her doctor, I mean, she's tried everything. She completely cut cholesterol out of her diet. Her doctor put her on omega-3, um, and she actually, her for the first time, like ever, her triglycerides and her total cholesterol are back in normal range. So that in itself, and I know her personally, I see her work out, I see her eat healthy and try really hard. I've seen her try to take Lipitor and other cholesterol medications that haven't worked, and there's no other explanation. So I've seen it personally um, work. So um, those are just a few examples of why I support omega-3 fatty acids. Um, I think it's extremely important, especially in our patients who are diabetic and who do have heart disease, because they're such dangerous conditions. Um, and the thing is, there isn't really a downside. Like sometimes they say, oh, well, you could bleed more, and that's just a huge risk, and you shouldn't take the risk. Well, your only reason you're gonna maybe possibly bleed more, bleed out, or have issues is if you're overdosing on the medication. But if you're actually taking the prescribed amount in this dose every day, you're not gonna have that issue. So really, the benefits are outweighing the risks that they're saying. I did look up all the risks for omega-3s, and they're not. The biggest one I saw was that was like a true proven risk was the possibility of bleeding if you overdose. But that is with anything that anyone takes. If you overdose on Tylenol, you could have liver failure. Well, if I have a headache, I'm not going to not take Tylenol because I'm afraid of liver failure. I'm just not going to take over 3 grams in 24 hours. So with that, I found way more benefits to omega-3 than reasons not to take it, and that's why I support it and disagree with Team 2 in that there are more side effects um, than there are benefits. So, thank you.